Hi, RocketSIP here. We are introducing our newest product, RocketSIP, which is an oral facial exerciser for kids. RocketSIP is a progressive resistant exercise tool for strengthening the oral facial musculature. Progressive resistance exercise is resistance that progressively increases as the muscle gets stronger. It's usually involved in resistant bands, free weights, and weight machines. Instead of weights and bands, RocketSIP uses 3 micro-sized straws which require pressured sucking. RocketSIP utilizes the principles of resistance training and, most importantly, the principle of overload. This states that in order to keep making gains from exercise program, you must find a way to make it more difficult. And how do we do that? There are 4 ways. The first is frequency. You have to increase the number of exercises to make it more difficult, so you stress the muscles. Secondly, you have to have intensity to reach overload, and this means you have to have some way of making the exercise more difficult. We utilize smaller and smaller micro-resistance straws. The third way you can adjust exercise to reach overload is through time. This means increasing the time that the child performs these drills, whether it's consecutively or in sets. And lastly, you can adjust the type. And that means that you can not only use RocketSIP, but you might use the tongue press, or you might use a chewy tube in order to reach overload. Utilizing the RocketSIP is fairly easy. You first fill the unit with liquid or some flavored beverage. Secondly, you instruct the patient on how to make an effortful suck. Third, you take baseline measures in milliliters of each suck that the child performs with each of the straws, and then you select the easiest straw and you start there, increasing the time, the frequency, the intensity in order to reach overload. The importance of an effortful pressured suck is that it increases the strength of the lips, the cheeks, the tongue, and it works the palate. RocketSIP's mission is basically to stabilize the normal resting relationship between the tongue, lips, teeth, and jaws, to decrease drooling, and to facilitate strong lips and cheeks to control the bolus, the solid bolus in the mouth. RocketSIP works well with treating drooling, faulty tongue positioning, tongue thrust, weak cheeks, or difficulty chewing solid foods and keeping it in the mouth. And it provides an added method for treating swallowing and feeding problems. RocketSIP comes with a graduated cylinder, a lip guard, a sliding gauge, a graphic of the solar system, a pour to prevent spillage, a decorative straw topper, 3 micro-resistant straws, 2 curly straws for reinforcement, and instructions. It is important to remember that progressive resistance exercise success is dependent upon a vigorous exercise regime, that the child's muscles are worked to the point of overload, that you're being consistent in the number of trials and the consistency of the practice sessions. You're advancing the child to more difficult straws and realizing that the tool is not a toy and exercise is not always easy. RocketSIP is excited to add RocketSIP to our growing number of clinician-developed research-inspired products for the treatment of swallowing and voice.